Welcome everyone to The Whole Itself Remains. I'm your host, Todd Caldecott, and you're listening to CJMP Co-op Radio 90.1 FM, broadcasting from the Qathet region on the beautiful Sunshine Coast of British Columbia on the traditional territory of the Ka'aman people. So this show is part of a weekly live Q&A series where subscribers can join me each Wednesday to explore health, healing, and human wholeness. After the broadcast, we will dive deeper into a 30 to 60 minute, even 90 minute Q&A where subscribers can ask me anything related to health and wellness. It could be clinical, personal, even philosophical, maybe even political, although that's not my first choice. Now, if you're tuning into CJMP or you're watching later on YouTube and you want to join this live conversation, stay with me and I'll explain how to subscribe at the end of the show. So over the past few episodes, this is the fourth episode, we've been talking about the concept of holism, the theory and practice of holism. And as I mentioned last week, I want to move forward and start putting this to some practical outcomes so we can begin to discern the difference between, say, conventional medical approaches in treating different health issues or considering different health issues and how we might treat it from a holistic perspective. As I mentioned, I think both are valid. I live in the Western world. I live in a system that uses modern medicine as its primary modality. So, of course, I have to work with it. And there are a lot of benefits and advantages to it, but also there are a lot of unintended consequences and pitfalls. And as a result, it's sort of a function of selection bias, but I end up seeing a lot of folks that have issues with the modern medical system. They're on inappropriately prescribed pharmaceuticals or maybe too many drugs, or maybe they just have an improper diagnosis. And I want to explore some of those things to help unwind the sort of dysfunction around how we approach these different health issues to help you come to a more complete, more holistic understanding of how to address it. So I think the first place to start when I talk about different health issues is digestive health. And this is informed by my perspective on Ayurveda, which states that digestion is the root of health. So that if our digestion isn't functioning correctly, how can we expect the body as a whole to function correctly? So our health is dependent upon digestive health. So it's a really good place to start. And if you can properly attend to digestive health, then there's a very good chance that every other parameter in terms of your health is going to likewise benefit. So we always focus in on digestion first in Ayurveda. And, digestion itself is in large part a reflection of what it is we eat. I don't want to say that digestive health is entirely dependent upon what we eat, but certainly it has to be the most important influence or effect. This is reflected not just in my philosophy, but informed by my practice and the results that I've obtained with people suffering from different digestive disorders and other health issues as well. If we could draw them back to some type of digestive dysfunction, it could be something like Parkinson's disease or autism, then you can definitely find a link back to digestive health. And it's really interesting how in Western medicine there's this sort of disarticulation between something so fundamental as diet from our knowledge or awareness of digestive health. It's really quite striking. Many years ago, I gave a lecture at the University of Calgary. This would have been maybe like 1998 or so. So I hadn't been in practice for all that long, but I had some experience treating digestive issues and also more severe forms like inflammatory bowel disease. So I was invited by the organizer for the local Crohn's and Colitis Association to deliver a lecture along with a gastroenterologist. So I was supposed to provide the alternative or complementary health perspective. And so my lecture was to follow this gastroenterologist's. And I sat in attendance, I watched his lecture, and it was everything you might expect from a gastroenterologist. It was a really, interesting slideshow with all kinds of images of people's ulcerated and inflamed intestines, and then a review of the latest medical treatments, which at that time, we're talking a long time ago, the big innovation were the 5-aminosalicylates in conjunction with, say, prednisone. So it was a good, thorough review of the different medical therapies that are used for inflammatory bowel disease. And then, he finishes his lecture to polite applause and step down. And then I was on the stage and, I didn't have any presentation. I didn't have any slides. One of the first things I said to the audience was, that was a great presentation, but it's very curious that an expert in digestive health talking about a digestive disorder didn't mention anything about diet. Because from my perspective, digestive health is entirely dependent upon diet. And to deny that is to deny reality. It makes no sense that you would just completely step over that particular issue. And so, and I mentioned that, like, if I'm working with someone with IBD and they don't work on their diet, they don't want to change their diet, I won't work with that person. It's just no point. They can go for the medical therapy, they can go get their bowel surgically resected, which is a definitive cure for IBD, just removing the bowel. It was really interesting because the audience was kind of split half and half between being in support of what I was saying and the other half, which was definitely not in support. And so I can't remember a time where I had so many people in the audience, jeering and cheering, shouting and pounding on the floor and clapping. It was quite raucous. And there were some gastroenterologists in attendance, and they asked me a question, and they're like, there's no definitive evidence at all that there's any relationship between diet and digestive health. And I just was kind of flabbergasted with the question, but there is an answer to it, which is that, of course, there's really no research. It's because nobody is conducting that research. There's no financial incentive for anyone to undertake what would really be an expensive study of the impact of diet on digestive health. And of course, subsequent to that, there have been some additional studies, but let's face it, clinical studies on diet are really difficult because you have to factor, everything that the patient consumes over an extended period of time. And it's very difficult to do. In most cases, it's just like diet diaries that are handed to patients. And I don't know if you remember what you ate 2 or 3 days ago, or even in one day, you might forget, right? And so they're not very accurate. They're not very reliable. And so that's really the reason why the answer to that question, why is there no correlation between diet and digestive health, is simply because it's not being studied. And this is a big gap that exists in the field of gastroenterology. It's certainly changed in the last, say, 30 years since I began to practice. And I'm happy to see that, but it's still very simplistic, very elementary understanding of dietary impacts. And so I want to talk a little bit about that today, about the importance of diet and the importance of having a holistic perspective when it comes to digestive health. So I thought today what I would do is spend some time talking about SIBO, small intestine bacterial overgrowth. And, not just small intestine bacterial overgrowth, but I'm going to include that as a broader pathology of the microbial dysregulation of the gut. I'm also going to include small intestinal fungal overgrowth as well. So SIBO and SIFO. So what are they? So SIBO, as I mentioned, small intestine bacterial overgrowth. This is a condition that is becoming quite popular on YouTube. Lots of people are talking about it. Lots of people are getting diagnosed with it. Is it a fundamentally new pathology that we've never seen before? Absolutely not. This is something that is really just a new name. So, what they say, new bottle, old wine. It's the same thing that we've seen for many years. There are certainly some changes that have happened in the last 30, 40 years. There's a lot more microplastics in the diet. People are exposed to a lot more in terms of different antimicrobial compounds. So there's a lot more pollutants and intoxicants that are found in the diet, that are found in the environment, and that certainly had a negative impact on the health of the microbiome. But that's been happening for many, many decades. It's just getting worse. But this idea that SIBO is a new condition that's never existed before, no, it's something that's been around. It's just a new name. One of the old names we used to use for it was IBS, which is a very frustrating term, irritable bowel syndrome, because it is kind of what we call a wastebasket diagnosis. It's what you'll get diagnosed with when it's not clear if you've got some other digestive issue, say like colitis, or you've got gastritis, and they'll put it into this IBS wastebasket. And it's a very poorly understood disease term, or it's a syndrome typically, and it doesn't really provide much, at least from a medical perspective, on like actionable treatment. Usually people are dismissed, or they're told it's in your head, or they're given antidepressants. So IBS is a very unsatisfactory diagnostic term, and so it's I welcome more nuance, and SIBO is an extrapolation of that IBS diagnosis. So it overlaps significantly. It displays many of the same symptoms that you would associate with irritable bowel syndrome. So nausea, bloating, vomiting, diarrhea, constipation, or alternating diarrhea and constipation. It relates specifically to the excessive growth of bacteria in the small intestine. Typically colonic type bacteria like E. coli or Streptococcus, and is associated, as I mentioned, with symptoms such as gas, bloating, and then diarrhea and or constipation. Small intestine fungal overgrowth is basically the same thing, except it relates to an overgrowth of fungal organisms, typically Candida species like Candida albicans, once again in the small intestine. It's considered to be less common, although I'm not so sure about that. It's harder to diagnose than SIBO, and the symptoms certainly overlap with SIBO. And I would think that in many cases, when we're talking about SIBO, we're also talking about SIFO. So it's the same thing with like chronic sinus infections. For the longest time, it was thought primarily to be a chronic bacterial infection. More recent research suggests that fungal organisms play a significant role, and it's this pattern of, there's a relapsing, remitting pattern of bacterial and fungal infection, where you use antibiotics to deal with the bacterial infection. It makes the fungal infection worse, and it just kind of compounds upon itself. We're basically talking about this broader term called dysbiosis, which means wrong of life. There's just, in contrast to, say, the term probiotic, which refers to organisms that help support the health of the body, dysbiosis represents a confluence of organisms, bacteria, fungi, that inhibit the health of the body in some fashion. Now, up to 78% of patients, it's theorized, may have undiagnosed SIBO. So a lot of those people that walk away from a clinical diagnosis of IBS feeling underserved probably actually have something like SIBO. The majority of them would. We're also seeing the same issue, although once again, it's not properly diagnosed, with SIFO, small intestine fungal overgrowth. The problem with this diagnosis is that there's no really good system of diagnosis. I'll talk about a little bit how we diagnose SIBO, but with SIFO, there's no really good method to diagnose it. So, there's a lot out there in the media, Instagram and social media, talking about SIBO and how to address it. And it's surprising to me that even among sort of holistic perspectives, there's a very kind of narrow understanding of how we address something like SIBO. You'll see advertisements for purified alkaloids such as berberine that's used, and berberine is an isoquinoline alkaloid that's found in many different medicinal plants. particularly plants that are bitter in nature, so herbs like barberry or golden seal. And of course, these plants contain many other alkaloids, many other constituents, flavonoids, etc., that have a synergistic activity that are so much more sophisticated and nuanced than just using something like berberine. To me, using berberine is just like using an isolated antibiotic and really is no different. And that's unfortunately the fundamental approach, it seems, in modern medicine, and adopted by many influencer type health practitioners, if we can call them that, where they'll just use something like berberine as a substitute for an antibiotic, but it's the same fundamental approach, just using or relying upon a very powerful antimicrobial to resolve the problem instead of getting to the root cause. So I want to talk about that. So when we talk about a holistic treatment of SIBO or SIFO, we have to address those root causes, addressing issues around motility, stress, the health of the microbiome, not just eradicating these problematic organisms. So the fundamental problem is that we have this accumulation of bacteria and or fungi in the small intestine. And normally the small intestine is mostly sterile. I mean, there's really no place in the body, except perhaps the brain, that is completely sterile because bacteria are everywhere. Microorganisms are everywhere. And we talked about this from a holistic perspective, that we live in concert with these organisms, that they represent just as much a part of our physiology as our own separate genome. So these organisms that we live amongst are actually part of us because we are part of the environment and they are part of us. But in the small intestine, it's relatively sterile. And what happens is that you get this overgrowth of bacteria and or fungi in the small intestine, and they begin to digest and ferment whatever foods you're consuming. And they ferment these, they produce gases. And unlike the large intestine, which is designed to accommodate bacterial growth, I mean, essentially that's what the large intestine is. It is a fermentation chamber to grow a poop. You're growing a poop every day, and you have these special house-strated structure of the colon where the chyme is squirted out through the ileocecal sphincter into the cecum, where it's mixed with bacteria, and the bacteria ferment it and basically grow a poop. That's what happens. But in the process, they expand, they grow. About 80% by volume of a poop is bacteria that you are creating, that you are generating, that you're growing inside your large intestine. And so there's a growth in bacterial volume, and also through the process of fermentation, a lot of gas gets generated. And the colon is perfectly adapted to this. It's a stretchy structure. So it is designed to accommodate this fermentation. Not the case with the small intestine. It is a rather narrow tube. It doesn't have the same type of stretchy function, so that when bacteria replicate in your small intestine, when gases are produced, it's really uncomfortable. It's usually a lot of pain, a lot of disability, discomfort. It's that sort of feeling like you've got a bunch of gas, like you could just have a great fart if you could, but you can't because the gas is being produced too far up in your GI tract, so it's nothing that you can easily expel. It's just got to gradually work its way out of your system. Whereas if it was in the colon, you might get that uncomfortable feeling, which is then relieved a short time later with the expulsion of gas. That's not what happens with SIBO or SIFO. So let's talk about the pathogenesis, because if we can get an understanding of what are the factors involved in causing SIBO and SIFO, then we can get our arms around it and then properly deal with it. So one of the most important issues I see in SIBO or SIFO is hypochlorhydria, or low stomach acid. So our stomach is a sac for digesting protein primarily, and produces a whole bunch of hydrochloric acid and then the enzyme pepsin, which gets converted or cleaved into pepsinogen. And that acid serves to denature proteins, break them down so that the pepsin can act upon those long chains of proteins, break them down into smaller peptide chains, which then are transferred to the small intestine. But in the process, the acid also has some type of non-specific immunological function, which is to say that anything that you consume that has bacteria is going to get denatured, hopefully, by the stomach acid. There's some organisms that are resistant to hydrochloric acid, and so they might survive that. There's an organism, Helicobacter pylori, which lives and thrives in the acid environment of the stomach. But most bacteria entering into the stomach, exposed to stomach acid, are going to be killed, denatured. But when you underproduce hydrochloric acid, then those bacteria are not being eliminated, and they are then being transported into the small intestine, where they can then begin to take up residence. So you allow these bacteria and fungi to take up residence from the stomach into the small intestine. So hypochlorhydria. And hypochlorhydria is also really important because it's the stomach acid which also kicks in a series of hormonal activities which in turn regulate the function of digestive organs downstream from the stomach. So the release of hydrochloric acid stimulates the release of gastrin, motilin, cholecystokinin, which in turn regulates motility, opening and closing of sphincters, the stimulus and release of bile from the liver and gallbladder. So if you are underproducing stomach acid, then you have a fundamental dysregulation of the gut through an impairment of the activation of these different enteroendocrine hormones. And as a result, the impairment of the enteroendocrine system results in an impairment of the sphincter function, of the duodenal sphincter, of the ileocecal sphincter that connects the terminal portion of the small intestine with the beginning part of the large intestine, the cecum. And as a result, it just creates all of these motility problems, which is very common that we'll see with SIBO and SIFO. And it ends up being kind of a vicious cycle, because if you underproduce stomach acid, if you have dysregulated hormonal regulation of the digestive tract, this in turn allows for an increase in inflammation within the gut and the gradual dysfunction of the local microbial ecology. So then you start cultivating or growing different microorganisms which are not probiotic or beneficial to you. This is the Beauchamp versus Pasteur argument. Both are valid, but the Beauchamp argument was that it is the environment, the local environment, which is the most important determinant when it comes to what type of organisms are going to exist there. And we have to consider both of them, but that is a really important consideration. So you end up with this dysregulation of motility, opening and closing of sphincters, and then this increase in inflammation, and then this shift towards a microbial dysbiosis. And there's some extenuating factors as well. So we talked about how those hormones like gastrin and cholecystokinin are really important to regulate the opening and closing of the sphincters. Well, there's the sphincter, as I mentioned, that separates the terminal ileum to the end of the small intestine with the beginning of the large intestine, the cecum. And as I mentioned, the small intestine is mostly sterile, but the cecum is not. It's like the back door of a fast food restaurant in the alley. You know, the back door is kicked open and then the cook just dumps a whole bunch of waste into the back alley and then all the rats come to eat it. Not a very hygienic way to deal with it, but if you travel the world, then you know that kind of stuff happens. Okay, so there's the same thing in your gut, that whatever squirts through the small intestine into the large intestine rapidly gets attacked and fermented by the microbes that are there. That's why we have this little supposedly vestigial organ called the appendix there. It's a storehouse of probiotic bacteria that can help to regenerate the microbiome if it's ever damaged through infection. So you have all these microbes, and in that area, in the cecum, it's also just heavily laden with lymphatic cells and lymphatic tissue to protect against these microbes that might otherwise infiltrate into the body. We have a big immunological barrier there to prevent against that. Now, if that sphincter that separates the small intestine from the large intestine gets weak, then you can get the retrograde flow of cecal bacteria, colonic bacteria, into the small intestine, where they then also set up residence. So then you have bacteria leaking from the stomach and bacteria leaking from the large intestine, so two ways, into the small intestine. So those are both really important factors when dealing with the origin of these microbes and how to resolve it. Now, once you have that problem through poor gastric function, through hormonal dysregulation of gut motility and opening and closing of sphincters, then you can make that worse by different factors such as your diet. So for example, if you have a history of eating a lot of fiber, the fiber normally fermented by colonic bacteria suddenly is now being fermented by bacteria in your small intestine, and they're growing and fermenting and creating gas and discomfort. So this is an important factor when you're dealing with SIBO or SIFO, is to, at least in the beginning, to regulate how much fiber you're consuming. And hopefully not to get onto a program where you're avoiding fiber for any extended duration, but just for the duration of whatever therapy, because overall, it's really important that you get sufficient fiber. Everything we know about digestive health is dependent upon an adequate amount of fiber. Our ancient ancestors consumed way more fiber than we do in our diet. But nonetheless, in the beginning, in treating this issue, you usually have to be very careful with fiber consumption. Probably the number one iatrogenic cause of SIBO and SIFO is antibiotic usage, which makes sense, right? You just wipe out the local microflora. But another underappreciated factor are the usage of PPIs, proton pump inhibitors. So these are drugs that are given to people that have gastric reflux, which is very common, to inhibit the production of acid in the stomach. Now, there is some rationale to use something like a PPI if someone has an ulcer, because if you keep producing acid, then that acid is going to eat away in the stomach line and make that ulcer worse. And so temporarily, it might be a good idea to allow the stomach to heal up properly to inhibit acid production. But it's important to note that most people that have an ulcer actually underproduce acid relative to the normal average individual. So it's not a function of too much acid per se, but usually a deficiency of the mucosal barrier that protects the lining of the stomach from these really potent acids. But the issue with GERD isn't that, it is that acid is being refluxed in the esophagus, and the esophagus, unlike the stomach, doesn't have this mucosal lining to protect itself against the acid. And it also represents a dysfunction of the esophageal sphincter that should normally close after you eat food. And so then your stomach begins its mixing, churning waves. If that sphincter isn't properly closed, then of course, as the stomach begins to initiate these churning, mixing waves, some of that stomach contents gets refluxed into the esophagus, causing esophagitis. And that's what we call heartburn. But it's pretty standard for folks to go to a medical doctor, to be diagnosed with GERD, to then get put on a PPI, and many patients will never be taken off of them, because just as soon as they attempt to remove the PPI, the symptoms come roaring back. And that's very common. But continuously diminishing, depleting, stopping the stomach from producing hydrochloric acid is the fundamental cause of SIBO and digestive dysfunction generally, and also a number of other problems such as anemia, because you need stomach acid to cleave B12 and absorb that, and B12 is used to synthesize red blood cells, is also associated with other problems such as risk of dementia, which makes sense to me when you think about digestive health and its connection. So that's an important factor as well. So this is something that if you're ever recommended to take a PPI, that you shouldn't be on a PPI for more than a few weeks. And of course, there are many alternatives that we can suggest instead of going on a PPI. But I've seen so many people that have wrecked their, not just digestive health, but their overall health by being on PPIs for more than just a few weeks, it's very common to find folks that have been on a PPI for a few years. Sometimes people, they're on them for like decades, which is, just kind of ridiculous. Another really important element in SIBO is the disruption of what's called the migrating motor complex, or MMC. This refers to the wave-like contractions that happen primarily during fasting that clear the small intestine of whatever is in it. And so if there's some dysfunction of the MMC, then that also can promote or cause something like SIBO. There might be some anatomical or functional abnormalities, particularly if the person's had some surgeries, if there's been post-surgical damage to the of the ileum, for example, like in Crohn's disease with the surgical resection of the ileum, then that can certainly contribute or cause issues. There might be strictures from surgeries. It could be another issue like a liver gallbladder disease, like a blockage of the biliary tree, so you're not producing and excreting enough bile into the small intestine. That'll have a big impact. Or something like chronic pancreatitis. That'll result in a reduction in the amount of digestive enzymes that are produced. If the patient is on immunosuppressive medications for different, say, inflammatory problems, like, say, rheumatoid arthritis, then that can contribute to this issue. Or there might be just immunodeficiency issues that can contribute to the problem overall. So those are some important, etiopathological factors when it comes to looking at SIBO that need to be addressed. Usually when we're seeing something that has SIBO or SIFO, as I said, there's significant overlap with what we call IBS, so nausea, bloating, vomiting, diarrhea, and or constipation. It kind of can undulate back and forth, or typically someone will be either like a diarrhea dominant or constipation dominant, or they'll go through phases of having diarrhea and then constipation. It can be very confusing and bewildering to know how to address it. On a chronic basis, SIBO and SIFO can cause malnutrition, definitely weight loss and malabsorption issues. You'll typically see things like steatorrhea, or fat in the stool due to impaired fat digestion, and that'll result in fat-soluble vitamin deficiencies, such as deficiencies of vitamin A, vitamin D, vitamin K, etc. It can lead to iron and B12 deficiencies, resulting in chronic anemia. And children definitely see this situation of a failure to thrive, so not putting on weight, not thriving. You might see it in other impairments in other aspects of the learning environment or social environment. If it's more related to SIFO or fungus, then you might see things like intense sugar cravings and physical itching. Usually we see on the tongue like a coated tongue. You might see something like thrush as well. And then you see that there's a lot of other overlapping conditions. People with SIBO or SIFO also present with issues like rosacea, fibromyalgia, chronic fatigue, which sometimes are viewed as being separate or different, but are often very much linked to something like SIBO or SIFO. In terms of diagnosis, the gold standard is the jejunal aspirate via endoscopy. It's a rather invasive procedure. It's poorly reproducible, and there's a risk of contamination as well. So typically breath tests are used to diagnose SIBO. So a hydrogen or methane breath test is taken after the patient is given something like glucose, lactulose, D-xylose, etc. Usually it's a 12-hour fast, and then the challenge substance is given, and then there's monitoring period over 2 or 3 hours. Unfortunately, the hydrogen test is unreliable if there's no hydrogen producing bacteria present, so you also need to test for methane as well. And then these bacterial breath tests, of course, don't detect fungi, so you may come up negative for SIBO but have SIFO, and SIFO isn't really properly understood or diagnosed all that often. So that's something that has to be considered as well. So let's talk about some of the important physiological considerations when looking at SIBO. So it's really important to make sure that we maintain the health of the stomach. And it actually begins with oral digestion. So how you chew your food, how quickly you're consuming your food, under what type of stressful environment are you consuming. A lot of us, especially if you're parents, you're kind of used to this thing where you're just stuffing a whole bunch of food and eating as quickly as possible because you don't have time, you're in a rush, the kids are going to bother you in just a second. So, you just, I remember doing that as a parent, and it's a pattern that I had to unwind, and really focus in on digestion. And as we say in Ayurveda, that eating is a yagya, or a spiritual ritual. So it's important to connect with that. And to obtain the full blessings of eating, it requires that we be fully mindful in that process. And when we don't, then it impairs all of those endocrinal functions, which end up impairing motility and affecting the function of the different sphincters. I mentioned earlier the migrating motor complex as being important to consideration. This is a cyclical wave-like pattern of electrical and muscular activity that occurs in the stomach and small intestine during fasting, about every 90 to 120 minutes. It has kind of a housekeeping role that sweeps residual food, bacteria, and debris from the stomach and small intestine into the colon, but it only occurs in a fasting state, and usually about 1.5 to 2 hours after eating. And when we eat food, it interrupts the migrating motor complex. It replaces it with what's called the fed pattern, or it's a non-propulsive contraction for digestion. And so when we are constantly grazing, snacking, or eating, especially late at night, it suppresses the migrating motor complex, and this allows for bacteria to accumulate in the small intestine. Another really important element in regulating the migrating motor complex is the vagus nerve. So the vagus nerve is a cranial nerve, and it's very important in regulating the stress response. So when we have high vagal tone, and this is associated with the so-called rest and digest state, or the parasympathetic state, this promotes a healthy migrating motor complex. But when we're stressed, we have poor sleep, there's some kind of trauma, or like a sympathetic dominance, we're in that fight or flight response, this can suppress vagal signaling and in turn suppress the migrating motor complex. Another really important consideration here is the role of serotonin. So, serotonin we know is a really important neurotransmitter regulating mood, behavior, learning. Well, 90% of the body's serotonin is produced in the gut, primarily by the enterochromaffin cells. And it plays a really important role in modulating motility of the gastrointestinal tract through those serotonin receptors. So if there's a disruption in serotonin signaling, this can impair the migrating motor complex and then contribute to this dysmotility and then this resultant bacterial or fungal overgrowth. Things that disrupt serotonin signaling, good example would be SSRI use. Also just general inflammation, a disruption in normal circadian cycles, or just dysbiosis. It can be kind of a vicious cycle pattern here. So when we think about treating SIBO or SIFO in a modern medical practice, typically it's just treated with a rotating course of antibiotics. In some cases, more recently, probiotics have been recommended with, fairly, unconvincing results, let's say, because I don't think they're usually used correctly. But the standard treatment, as I mentioned, are this rotating course of antibiotics. And a lot of sort of holistic influencers have kind of capitalized on that notion and have chosen to use things like purified berberine as an alternative, but it's really just the same thing. It doesn't really get to the root cause. And we need to have a fundamental root cause understanding of SIBO to get any success with it. So from the perspective of Ayurveda, which views digestion as being the root of health, the cause of SIBO is this fundamental weakness of digestion, caused by eating unwholesome foods and the additional lifestyle factors that modulate that. So one of the key components here is improper food combinations. This is a really important element. So remember what I said about the stomach. It is a sac for digesting protein, essentially. So whenever you're eating animal protein, it goes in the stomach. There are cells there that pick up on that, sense that, and then initiate the release of hydrochloric acid and pepsin to break that down. If there's no protein in the stomach, it's just say carbohydrates. Let's say you eat some watermelon or you eat a rice cake. That food is not going to spend very long in the stomach. It's going to get passed on to the small intestine because there's nothing for the stomach to do with it. But if you take a carbohydrate and a protein, let's say a steak and a potato, and you consume that, and now that goes into your stomach now has a puzzle. Because some of these foods, like the potato, inhibit the secretion of hydrochloric acid, and some of the foods, like the steak, initiate the secretion of hydrochloric acid. So you get this mixed effect from the stomach. It's confusing for the stomach. And if you have really strong digestion, typically it's not so much of a problem. Just imagine like if you are feeling good, you got good sleep, maybe you had a cup of coffee, and now you're sitting down to do a puzzle, you're probably going to do a really good job. But let's say the opposite happened. You didn't have your coffee, you didn't have a good sleep, you're feeling stressed, and now you're sitting down in front of a puzzle, and now you have to figure that out. It's going to be a lot harder. It's the same with your stomach. So when you mix proteins and carbohydrates, which digest in chemically opposite mediums, you give your stomach a puzzle to figure out. And if your digestion is strong, it's not a problem, but that's not the case for many people. And certainly if you have this as a pattern, then you need to know that you want to keep those foods separate at separate meals. So improper food combinations, that's a key one. Eating raw or improperly prepared food. Eating too much food and eating food too frequently or at irregular times is a really important consideration in SIBO and SIFO. We want to try to reduce your meal consumption to like twice a day if we can. And maybe 3 times a day, but not eating all day long. It makes no sense and will exacerbate and make this issue worse. So people will self-identify as grazers. That doesn't make any sense in treating SIBO. It's going to make the problem worse. And then, as I mentioned, like just chronic mental and emotional stress. Certainly, experiencing that while you're eating is a big factor. But just generally speaking, it puts you into the state of sympathetic stress, and that impairs the function of the vagus nerve, secretion of all those digestive enzymes, the motility of the gut, all gets impaired when you're in the state of chronic mental and emotional stress. Now, of course, there are important dietary factors, and I'm going to talk about them if I can before we wind things up for today. Typically, this pattern is associated with a wide variety of foods that cause problems, and often people will end up following a certain diet but kind of painting themselves into a corner where the food choices become progressively more and more limited. Now, it's important to note that in treating SIBO or SIFO, you may need to go on a restricted diet for a short period, but the goal is to get you back to a relatively diverse diet. That said, there may always be foods that you might need to avoid, to be very careful around. Most of those foods are going to be the typical standard American diet foods, all the industrial foods, the junk foods, the over-prepared refined foods. You want to avoid those foods across the board. But even then, there still might be certain foods that you might need to avoid. And those are things that can be understood on an individual basis, as opposed to applying a general rule. Very often SIBO is associated with this condition called histamine intolerance. A lot of people will have allergies or skin eruptions associated with the SIBO, and then they end up having to, avoid a long list of foods that are known to provoke a histamine response. And that's another factor here. So there's the so-called histamine diet. It's a very, very limiting diet. Certainly it might make sense for a period of time to go on a histamine diet, but long term, it's not a good idea. And if you're on a histamine diet for a long period of time, then whatever you're doing isn't working. It's not effective. And there's definitely ways we can ensure that you can get back to eating at least some foods, which in a worst case scenario would promote a histamine response. There's an issue of probiotics and lacto-fermented foods. Remember, you have an overgrowth of microorganisms in the small intestine. Many of them are actually probiotic organisms. They're just in the wrong place. So even the lactobacilli and bifidobacterium that are helpful, that are probiotic organisms in the large intestine, in the small intestine, they are not necessarily and can be counterproductive. So you have to be careful about the introduction of probiotics and lacto-fermented foods and make sure you introduce them later on in the protocol, certainly not at the beginning of the protocol. So we have this process we call the graduated diet in Ayurveda. We follow this graduated process of eating really simple foods like a soup that gets progressively more complex, like a soup to a stew, and so we kind of follow this pattern. And then at a certain point in that protocol, we will then introduce something like a live culture food or probiotics, but only once digestion is properly seated and symptoms for the most part have begun to abate. So let's talk about like a general holistic protocol. We just got 10 minutes left, and so it's going to be a really brief or quick overview. These are the types of things that I would consider if I'm working with someone that has SIBO or SIFO. So as a therapeutic overview, the first things we want to, number one, restore digestion. Number two, we want to clear out the pathogenic organisms. We want to starve or kill the overgrowth. Number three, we want to repair the gut to support the mucosa, to support proper gut motility. Number four, we want to re-inoculate the gut to reestablish a healthy gut microbiome. And then number five, to retain whatever lifestyle changes or nervous system support we're employing through this process to help regulate the vagus nerve, to regulate the nervous system, to modulate that stress response so that we're not making it worse just through this nervous system response. So with regard to diet, the simplest thing is to make sure that you eat at regular meal times. Never eat if you're not hungry. That's something that some people just do. And sometimes you're forced into doing it in this workaday world. You got to be at work at 8:30 in the morning, so you get up and you have a bowl of oatmeal at 7:30 and you're not even hungry. And then you just feel uncomfortable for the rest of the day because of that. I have no solution to treat the workaday world except to find some way to extricate yourself from it. But there are some adaptations you can make, such as, for example, you would make a breakfast and then you would bring it with you to work, and then you would only eat it when you actually have an appetite. It seems simple, but it makes a lot of sense, and it's a really important consideration to not eat unless you are hungry for the most part. Now, I don't want you to waste away and starve, and there's things that we can do in terms of therapeutic interventions that can encourage a good appetite, and that might need some attention. But overall, you want to make sure you eat at regular meal times, don't eat if you're hungry, and definitely avoid overeating, and eating especially at night. You don't want to eat basically after 6 or 7 at night. If you go to bed at say 10 or 11, then don't eat later than 7 o'clock at night. You want to avoid raw, cold, greasy, overly sweet, and in the beginning, high fiber foods in the acute phase of SIBO or SIFO. You want to use warm, simple meals, generally speaking. In Ayurveda, we use a dish called khichdi or some type of soup or a stew. These can be modified depending on individual factors. Like the Ayurvedic approach that uses the graduated diet relies a lot on rice and mung bean. Not everybody is suitable for that. Right? People of Northern European heritage often have some intolerances to grains and cereals, making it incompatible. But nonetheless, soupy, warm, simple meals to align with appetite and digestive strength. Periodic fasting on something like warm water. Like if you're not hungry, then just drink some warm water. That'll be an encouragement or stimulant to digestion. And then following this approach of the graduated diet that we use in Ayurveda, whether it's vegetarian or non-vegetarian, doesn't matter so much. And then incorporating into this, you can weave in what we call a low FODMAP diet. So FODMAP is basically another word for fiber or roughage. So remember that fiber that you don't digest is fermented by microorganisms in your gut. If you have an overgrowth in your small intestine, then you don't want to be feeding those microbes by eating a lot of fiber. Even though you hear that fiber is good for you, in this context, it's counterproductive. So until we have resolved this issue of this bacterial or fungal overgrowth, especially bacterial overgrowth, you want to limit the amount of fiber you consume. But you want to be careful not to do that for a long period of time. If you're following this protocol and you're on a FODMAP diet for more than, say, 3 months, then it's not working and you need a different approach. And then, we use a whole bunch of herbal therapies to address this. And, I've got a ton of different medicines that I would use. So I'm just going to mention a few of them. We want to use herbs to enkindle the digestive fire, so digest stimulants. This would be herbs like dried ginger or pipali. Cayenne pepper can be helpful here as well. Carminatives, such as dill seed or wild celery seed, caraway, fennel. Chamomile is really nice. Calamus is another one. You want to decrease intestinal inflammation, irritation, and spasm. In Ayurveda, we use a special class of alkaline remedies that are used with these carminative and digestive stimulants. So there's one called Sankhabhasma, which is the calcinated ash of the conch shell. And it's mixed with carminative and spicy herbs to have a dual balancing activity to both stimulate digestion and yet decrease inflammation. We'll use antispasmodics to reduce spasm. Some of those already mentioned, like the carminatives like dill and fennel. But there's other ones. There's herbs like bilwa we use in Ayurveda, or hingu is another one. Hing is really good. And some Chinese herbs like chenpi, which is the citrus peel, or shanza, which is the Chinese hawthorn fruit, is very good. Also, wild yam is good. Cramp bark is another one that's helpful. Hops can be helpful. Cannabis can be helpful, as long as it doesn't make you overeat and eat the wrong thing. Cannabis can be helpful to reduce spasm and pain. It can be very effective. And then medicinal herbs that can be used to heal up the inflammation that's there. So herbs like calendula or plantain, self-heal, licorice root, chickweed. These are herbs that I might consider using to help heal up the mucosal inflammation. And I would probably use those with demulcents. So herbs like marshmallow root is very effective, or slippery elm. The Ayurvedic herb shatavari can be helpful here. The challenge with demulcents is that they're rich in mucopolysaccharides. These are complex fibers that don't get broken down and digested and can become a substrate for bacterial fermentation. So you want to make sure that you use them judiciously and at the right time. Now, a really important factor in regulating gut function is going to be the liver. So supporting bile synthesis and excretion. So herbs like the Chinese herb chai hu, bupleurum, dandelion root, turmeric, gentian, barberry, they're very helpful here. Using herbs to prevent diarrhea and dehydration can be helpful. So that Ayurvedic herb bilva is helpful here. Bayberry can be helpful, cranesbill geranium. And then we can also pull out those herbs that help to balance the gut microbiome. This is where we're actually clearing or killing out some of those pathogenic organisms. These are usually very bitter herbs, so that's basically like herbal antibiotics. But look at all the stuff that we've applied before even considering using these antibiotics, these antibiotic herbs. And they don't even work exactly like that. They work in much more sophisticated, complex, nuanced ways. It's not just going in there and using a single alkaloid like berberine to kill microbes. We're eliciting a very complex, nuanced effect. But it includes herbs like barberry, from which we do get berberine or golden seal. Coptis is an Ayurvedic herb called kutaja, is very helpful. Hing and garlic, gugul. There's any of the artemisias like sweet anea or wormwood can be helpful here. Black walnut, neem is also helpful, or paudarco. The thing about all of these herbs is that they're bitter and cooling in nature, and by that factor, they are bad for digestion, because digestion is a function of warmth and juiciness. Right? That's how you know your digestion is functioning correctly. It exhibits those qualities. And if we use these herbal antimicrobials, the problem is that they can have an adverse effect on the gut. So we want to make sure we're strengthening the gut along with the use of these herbs. We're not just limiting our application to these antimicrobials. And then, in addition to herbal therapies, there are other measures we can take to promote neurological and vagal regulation. So vagal nerve massage, so a gentle stroking or massage of the carotid sheath near the sternocleidomastoid Humming or gargling, breath work like deep diaphragmatic breathing is very helpful with slow exhalations. Extending the exhalation relative to the inhalation is very helpful here. And I found a lot of use for folks that have a problem with with motility issues, which clearly relates to like a serotonin deficiency of psilocybin microdosing, so magic mushroom microdosing. And it enhances the MMC through activation of the serotonin receptor. It also supports neuroplasticity of the gut-brain axis and can get to some of the root causes of some of the mental and emotional stress related to this particular problem. So I found it to be very helpful in certain cases. And then probiotics. Probiotics can be helpful here, but remember, we only introduce probiotics after appetite and digestion begin to improve, not at the outset. And then we can choose different bacterial species on the basis of like what kind of symptoms do we see. So if it's more of a constipation dominant pattern, then we're going to rely more on Bifidobacterium species, Bifidobacterium infantis or lactis. Whereas if it is more the diarrhea dominant strains, then it might be Lactobacilli or Saccharomyces boulardii, particularly if it's for SIBO. So Saccharomyces boulardii is a non-colonizing yeast that can displace Candida. But make sure you're using it in the right circumstance. You're not going to use it if someone has constipation. That would be the wrong choice. And you want to avoid probiotic strains like Lactobacillus fermentum, especially early on, because they can worsen symptoms. And you don't have to consume probiotic supplements. You can take lacto-fermented pickles. I'm a big fan of those. And at the outset, what you might do is just consume a little bit of the brine from a lacto ferment. So not even eat the pickle, but just consume maybe like a half a teaspoon of the brine, and then gradually work your way up to eating the pickle. And then, there's other, dairy sources like yogurt and buttermilk, but because people typically have issues with the dairy protein, you have to be a little careful with those because you might be causing another issue. So I'm a bigger fan of using the live culture veggies. So that is an overview of how I would treat SIBO or SIFO. It's a little more complex than just the way I laid it out, and there's lots of different opportunities for nuance and sophistication depending on what the individual presents with. It's really important to make sure that you deliver a personalized approach. So this is just like a general overview of what you can do to resolve it, and you need to consider if you're dealing with bacteria or fungi or some admixture, i.e. a dysbiosis. The most important things is make sure that you don't ignore the upstream issues like the function of stomach acid, the synthesis and release of bile, the function of the nervous system are really important. And so don't forget about those things. And then long-term recovery relates to retraining gut motility and restoring ecological balance, and also becoming more aware of how you might be overtuned or oversensitive to information coming from the gut. Particularly if you've had a long history of digestive issues, sometimes any type of digestive symptom can set off some type of negative response. So sometimes the best thing you can do when you have some kind of negative digestive symptom is to find something else to do. Don't sit there and focus on your digestive symptom. Go out for a walk, go do something fun, distract yourself in some fashion and sort of turn down the volume on your digestive symptoms, and it'll help to disengage you from this vicious cycle pattern where some digestive symptom sets off some type of emotional response, which in turn promulgates this issue further. So that's an important consideration as well. Okay, so that's my overview of SIBO. I look forward to receiving any questions that you might have, and that winds things up for today's show. Now remember, if you want to join the Q&A, all you need to do is go to dogwithbotanical.com/subscribe, and then you can be part of the Q&A and ask me any question that you want. Otherwise, you can listen to me here on CJMP Radio 90.1 FM and also on YouTube, youtube.com/Todd Caldecott. Okay, so hopefully in one of those venues, I can connect with you. Remember, if you have any questions, please share. I look forward to connecting with you next week. Until then, take care.